My name is Wrd111, and this is my WRD11 Speech Thesis rough draft. The topic is gentrification and the health and well-being of others. When it comes to the health and well-being, the gentrification process can hurt people who live in these neighborhoods. The people who live here often have various underlying physical health issues from poverty and a lack of access to health care. However, gentrification can often promote the community's physical well-being through land development. Even though gentrification brings an influx of money to more impoverished neighborhoods, we need to utilize and update the land already available in the community and create access to affordable health care for those below the poverty line by assisting smaller clinics that are already established, on top of creating programs that would work with the current residents to afford treatment in an already established hospital. One of the articles that I've included discuss how gentrification process can be positive for the people moving into the neighborhoods more so than those already there. This article goes on to talk about how and why most urban reconstructions that were put into place to help people get the resources that they need often ended up hurting the same people that they were supposed to help. There's a lack of research that directly links gentrification to the minority health outcomes. This article addressed this gap with the individual data from 2008's Philadelphia Health Management Corporation's Southeast Pennsylvania's Family Health Survey and the Census Tract data from 2000. They also used the American Community Survey from 2006 to 2010. These studies also provide recommendations to tackle these serious urban health issues. Perceived Pathways, the study, tourism, gentrification, and health, a participatory photo voice study in the neighborhoods of Barcelona in 1982 says that tourism gentrification is currently the most severe public health problem in Barcelona. This study identifies various pathways between the tourism gentrification and the wellness they use in participatory action research to benefit and support the empowerment of the residents. These residents take pictures and talk about how the things in their communities can affect them positively or negatively. They use these pictures and their community's research to associate that with how they can help the community, giving their community people a voice instead of making all the decisions for them, even though most of the people making the final decisions don't live in these areas. The Association of Minority Self-Related Health with Black versus White Gentrification discussed there exist controversies as influence gentrification of cities have on welfare and minorities. About the cues of gentrification and causation wellness disparities for deprived minority populations residing in neighborhoods changing due to these socioeconomic shifts, with understudied implications for someone's wellness and health, protective residential area resources for low income and minority residents, increased observation on urban wellness inequalities possess and propelled questions on the correlation between gentrification and wellness. Nevertheless, there are vital changes built into the study of gentrification and how gentrification and wellness play hand in hand. These vital challenges are what build currently most of the studies that we face today in the problems.